Hi, I'm a clinical exercise physiologist and I help to treat and prevent heart disease. So, one of the things we're chatting about is risk factors, and the risk factor I want to chat about is high cholesterol. Now, the reason high cholesterol can be a risk factor is because it can be part of the process that starts to narrow down the arteries in our body. Now, specifically, we're talking about the arteries that sit on top of our heart called your coronary arteries, and these arteries feed the heart muscle itself. Now, we want to keep those arteries nice and open and clean and clear so that your heart can get all the blood flow and oxygen and nutrients it wants and needs. But what happens is if we start to develop this kind of disease process inside those arteries, it starts to narrow them down. This gunk starts to form and it starts to narrow them down and blocking them off either completely, causing a heart attack, or narrowing them down enough that it starts to impact the amount of blood flow that can get to our heart. And we don't want to do that. So cholesterol is part of that gunk that starts to build up and narrow down those arteries. And so we want to decrease the overall cholesterol in our body to help that process out. And so there's two types of cholesterol that we tend to focus on. One is our LDL. This is the lousy or bad cholesterol because this is the gunk that's in those arteries. So we want to keep that nice and low. And then the other type of cholesterol is our HDL. This is our happy cholesterol or the good cholesterol. And its job is to actually help pull out the bad cholesterol, almost like a little bit of a snowplow, pulling out all the snow in those arteries to keep them clean and clear. So working on trying to boost our HDL and limit or lower our LDL within reason is what we want to focus on in terms of helping our overall disease process. Now we can get into the numbers and we can get into kind of all the things that we can do to help that. But just overall to let you know, cholesterol is a risk factor. Watch your family history. If your mom and dad, sisters, brothers have high cholesterol, then you might be at more risk as well. Okay? Checking it out with your doctor, making sure you know your numbers is a good first start. All right, we'll talk to you soon.